Hi, I'm Chris Good, a spine surgeon at the Virginia Spine Institute. I'm going to try and explain in patient terms about the diagnosis of lumbar spinal stenosis. Spinal stenosis is a very common condition that affects our spines and can cause people to suffer with back pain or with pain and weakness that radiate down the legs. In order to really understand, we've got to kind of understand what's going on with the spine. So if we look at the anatomy, we're talking about the lumbar spine or the low back. And the spine is a series of bones and discs that are stacked one on top of another. These all move in relation to each other, just like cars on a roller coaster. And so as we live our lives, our spine is constantly moving. This is a very dynamic situation. Now, the bones and the discs are stacked together in the front, and the nerves come off the spinal cord, and they're running inside the spine, like a cable inside a conduit pipe. And the little nerves inside the back, they branch out by each disc, and those nerves branch out and they run through our pelvis and down our legs like little electrical cables, okay? Now, when we move at each segment or each level of the spine, we move through the disc in the front and its corresponding facet joints in the back. So there's this motion segment that has a disc and the facets. And it's important to know this because all of these structures can be involved in causing symptoms for people. Now, if we zoom in on a model specifically of the low back, we again see the bones and the discs, and you can see the nerves are running right down the middle like a cable in a conduit pipe. Now, spinal stenosis is a situation where some type of material, disc or bone spurs, starts to encroach or fill in the space where the nerves are supposed to be, eventually getting to the point where it's squishing the nerves inside the back. And so stenosis literally means narrowing of space inside a tube. Okay, so one common cause that this will occur is that throughout the course of our lives, our discs will naturally age. And the discs will start to crack and tear. Think of an old rubber band sitting out on the desk over time. It will start to dry, and eventually it almost starts to disintegrate away. Well, if that happens to a disc, then the bones can start to bulge together, and disc material kind of pooches out, and it can end up going into the area where the nerves run. This narrowing of the space around the nerves is called spinal stenosis. And if we look at what people will commonly feel, most people will feel some kind of pain in their back, but they'll also commonly feel pain that radiates from their buttocks down their legs, sometimes all the way down to their feet. Sometimes they will also have things like numbness or weakness in the feet or legs. It kind of depends on how bad the spinal stenosis is. Now, what I'd like to do now is go to an MRI scan so we can look a little bit more in detail. So if we look at these type of disc problems, they're extremely common. And essentially all of us will develop some degeneration of the discs in our back if we live long enough. Most people, luckily, really do not have major problems from their disc issues. But if you're developing worsening pain, and certainly if you're having things like numbness or weakness and you're unable to walk because of these symptoms, then that really does warrant an evaluation. Now, luckily, while this is really common, most people are successfully treated with the right kind of exercises and medications, sometimes injections. People who are better off considering surgery are typically people where those things haven't worked, or if you're developing any kind of worsening weakness, feet are numb, ankles aren't working well, people who have progressive neurologic problems typically are the kind of people who should be thinking about a surgery.